There is one simple mistake almost everyone makes after 70, and it has nothing to do with diet, exercise, or medication. It is something so ordinary, so built into the daily routine of nearly every senior I have ever treated, that most patients look at me in disbelief the first time I explain it, because it seems far too small to matter for something as serious as blood pressure. I am Dr. James Fontaine, and in 20 years of practice, this single overlooked habit has come up more consistently than almost anything else when I trace back why a patient's numbers refuse to stay controlled, even on the right medication, even with a reasonable diet. Today, I want to explain exactly what this mistake is, why it matters so much more after 70 than at any other point in life, and the simple adjustment that fixes it. The mistake is measuring blood pressure incorrectly, and more specifically, measuring it at the wrong time, in the wrong position, immediately after doing something that temporarily and artificially inflates the reading. I know that sounds almost too simple to be the answer, but let me walk you through why this single issue causes more confusion, more unnecessary medication changes, and more anxiety in my patients over 70 than almost any other factor I deal with. Here's what typically happens. A patient wakes up, gets out of bed, walks to the bathroom, comes back, and sits down at the kitchen table to check their blood pressure before breakfast. This seems perfectly reasonable. But in that short walk, especially first thing in the morning when blood vessels have not yet fully adjusted from a resting state, systolic pressure can temporarily read anywhere from 10 to 20 points higher than your true resting baseline. Add a full bladder, which is extremely common first thing in the morning and which independently raises blood pressure readings by 5 to 10 points on its own, and you have a reading that looks alarming on the monitor but does not actually reflect your real cardiovascular status. This matters enormously after 70, specifically because of something called orthostatic and postural blood pressure variability, which simply means that as we age, our blood vessels take longer to stabilize after any change in position or activity. In your 40s or 50s, walking across a room and sitting down might only shift your reading by 3 or 4 points, and it stabilizes within a minute. Past 70, that same brief walk can shift your reading by 15 or 20 points, and it can take 5 to 10 minutes for your body to fully settle back into its true resting state. If you check your pressure in that window, you are not measuring your blood pressure. You are measuring your blood pressure in the middle of an active physiological adjustment, and the number on the screen is essentially meaningless as a baseline, yet it is the number so many of my patients write down in their log and bring to me as evidence that their medication is not working. I have had patients arrive at appointments distressed, telling me their morning readings have been in the 160 range for a week straight, convinced their heart is failing them, when the actual explanation was nothing more than checking the pressure 45 seconds after getting out of bed and walking to the kitchen. When we changed nothing about their medication, nothing about their diet, and simply had them sit quietly for 5 minutes before measuring, with both feet flat on the floor and their backs supported, the readings dropped into the 130 range, which was their actual accurate baseline the entire time. Let me explain the specific physiology behind why this happens, because understanding it will help you remember to do it correctly every single time. When you stand up or walk, your body needs to redirect blood flow to your legs and maintain adequate flow to your brain against gravity. It does this through a rapid, automatic tightening of blood vessels throughout your body, controlled by your autonomic nervous system, along with an increase in heart rate. In younger adults, this system responds almost instantly and precisely, adjusting blood pressure just enough to maintain stability without significant overshoot. As we age, the autonomic nervous system becomes less precise in this response. It often overcorrects, tightening blood vessels more than necessary and for longer than necessary, which produces exactly the kind of elevated reading I am describing. This is not a malfunction or a sign that something is wrong with you. It is a completely normal, well-documented change in how the aging cardiovascular system regulates itself, but it means the way you check your blood pressure has to change to account for it. So here is exactly what I tell every one of my patients over 70 to do, and I want you to follow this precisely because the small details genuinely matter. First, use the bathroom before you check your pressure, not after, because a full bladder alone can add 5 to 10 points to your reading through a reflex that increases sympathetic nervous system activity. Second, sit quietly for a full 5 minutes before measuring, in a chair with back support, both feet flat on the floor, not crossed, because crossed legs alone can add another 2 to 4 points. Third, rest your arm on a table or armrest at roughly heart height, not held up in the air and not hanging down at your side, because arm position below heart level can inflate the reading and arm position above heart level can artificially lower it. Fourth, do not talk during the measurement, because talking activates the same systems involved in physical exertion and can raise your reading by 10 points or more. Fifth, take 2 readings 1 minute apart and use the average, because a single reading, even done correctly, can still reflect a small amount of natural variability that averaging smooths out. I want to give you a real example from my own practice because I think it illustrates just how much this single change can alter the entire picture of a patient's health. A patient of mine, a retired accountant named Frank, 74 years old, had been convinced for nearly a year that his blood pressure medication had stopped working. His home readings consistently showed 155/95, well above target, despite being on a reasonable dose of medication that should have controlled it. He had started restricting salt aggressively, cut out foods he loved, and was, frankly, miserable and afraid. When I finally watched him take his own reading in the office, I noticed he checked it standing at the kitchen counter, immediately after walking in from getting the mail, with his arm hanging at his side while he held the monitor with his other hand. Every single one of those factors was working against an accurate reading. We changed nothing about his medication. We simply retaught him the correct technique: sitting, resting, arms supported, bladder empty, no talking. Within a week, his readings settled into the 128/82 range consistently. His medication had been working the entire time. The mistake was never in his cardiovascular system. It was in the measurement. I want to address something else that comes up constantly, which is the question of what time of day matters most for an accurate baseline reading. I generally recommend checking in the morning before any coffee, which itself can temporarily raise systolic pressure by 5 to 10 points in sensitive individuals, and in the evening before dinner, ideally at a similar time each day, so you can track genuine trends rather than comparing readings taken under completely different conditions. Consistency in timing matters just as much as correctness in technique, because you want to be comparing similar situations to each other over the days and weeks, not a rushed morning reading to a relaxed evening one. I also want to mention white coat effect, which is closely related to everything I have described today, and which becomes more pronounced with age as well. Many of my patients show noticeably higher readings in the clinical setting than they do at home, simply because the anxiety and unfamiliarity of a medical appointment activates the same sympathetic nervous system response as standing or walking does. This is exactly why home monitoring, done correctly using the technique I just walked you through, is so much more valuable than a single office reading for understanding your true day-to-day cardiovascular status. I actually trust a properly taken home log far more than a single number taken during a 15-minute appointment, and I encourage every patient over 70 to keep one. I want to be clear about something important here. I am not telling you that correcting your measurement technique will cure genuinely elevated blood pressure. If your properly measured, resting, seated readings are consistently above your target range, that is real information your doctor needs, and it may well require medication or lifestyle adjustment. What I am telling you is that before you or your doctor make any decisions based on a reading, you need to know that the number you are looking at actually reflects your resting cardiovascular state, and not an artifact of how and when it was taken. I have seen medication doses increased unnecessarily. I have seen patients placed on additional medications they did not need, all because of readings taken incorrectly that overstated the true problem. And I have equally seen the reverse: patients who checked their pressure immediately after sitting down from a long walk and got a falsely reassuring low reading, missing genuine hypertension that needed treatment. The fix for all of this is not complicated, and that is exactly what makes this mistake so significant. It costs nothing. It requires no new medication, no dietary overhaul, no supplement. It simply requires 5 minutes of stillness, correct posture, an empty bladder, and a supported arm done consistently at similar times each day. That is the entire correction. And yet, in my 2 decades of practice, I would estimate that fewer than 1 in 5 patients over 70 were checking their blood pressure correctly before I walked them through this the first time. If there is one thing I want you to do after watching this video, it is simple. The next time you check your blood pressure, stop for a moment before you do. Use the bathroom first, sit down, rest your arm on a table, wait 5 full minutes in silence. Then take your reading, wait 1 minute, and take it again. Compare that number to whatever you have been recording. You may be surprised at what you find, and that number, the accurate one, is the one that should be guiding every conversation you have with your doctor about your heart. I want to walk through one more scenario, because it comes up almost as often as the walking example I already gave you, and that is checking blood pressure right after a stressful phone call or a difficult conversation. I had a patient, a widow named Eleanor, 79 years old, who called my office concerned because her reading had jumped to 170 over 100, a genuinely alarming number if it were accurate. When we talked through her morning, she mentioned she had just gotten off the phone with her insurance company about a billing dispute that had been frustrating her for weeks. That single stressful call was almost certainly responsible for the bulk of that spike. Emotional stress activates the exact same sympathetic nervous system pathway as physical exertion, releasing adrenaline and constricting blood vessels, and in someone over 70, whose system already tends to overcorrect and takes longer to settle, that spike can be dramatic and can also take considerably longer to fade than it would in someone younger. I asked her to wait 30 minutes away from the phone doing something calm and then check again. Her reading had settled to 134 over 84. Nothing was wrong with her heart. Something was wrong with the timing of her measurement relative to an emotional event, and that distinction matters enormously for how you and your doctor interpret your numbers. This is why I always tell patients to think of their blood pressure monitor almost like a photograph rather than a video. It captures a single instant, and that instant can be influenced by dozens of small factors that have nothing to do with your actual underlying cardiovascular health. A photograph taken while you are mid-stride running for a bus does not accurately represent how you generally look standing still, and a blood pressure reading taken mid-recovery from walking, talking, stress, or a full bladder does not accurately represent your resting cardiovascular state. The goal is always to capture the photograph under the same calm, consistent conditions every time, so that what you are comparing across days and weeks is a true trend, not a collection of mismatched snapshots taken under wildly different circumstances. I also want to mention temperature because it is another factor that surprises people and becomes more relevant with age. Checking your blood pressure in a cold room or right after coming inside from cold weather can cause blood vessels to constrict and temporarily raise your reading, sometimes by 5 to 8 points. This effect is more pronounced in older adults because the body's ability to quickly redistribute blood flow and regulate temperature becomes less efficient over time. I recommend checking your pressure at room temperature after being indoors and settled for at least 15 minutes, particularly during colder months when this factor is most likely to distort your numbers. If this video helped you, I would love to know a little about who is watching. Comment below and tell me what city you are watching from, or simply tell me your age. I read every one of them and it helps me know who I am actually talking to when I sit down to make these videos. Subscribe for more of these honest conversations about the heart and everything that quietly shapes it, and share this with someone whose blood pressure could use this information. This is Dr. James Fontaine. Take care of that heart of yours, and I will see you in the next one.